What do you think should happen when our customers meet their deductible? We pay for their...
All right, let's talk about coinsurance. Essentially, when you have an insurance plan, you have something called a deductible. A deductible is a set amount. Usually it's around between $500 to $5,000, depending on how high your premiums are. After you've met your deductible, then the insurance kicks in and starts covering something. But if you have a co-insurance, then they don't cover the full amount. A co-insurance can vary from as high as 40% to as low as 10%. All right, using the example I used in another video, let's say, for example, you're getting a procedure that's $2,000 and you have a $500 deductible. You're going to have to pay the first $500. You have $1,500 left. And for the sake of this example, let's say you have a 33% co-insurance. That means you're going to owe about a third of that total leftover cost, which is another $500. So it's going to cost you $1,000 to get the procedure done. Now, keep in mind, doctors are legally obligated to charge the co-insurance. Now, for every procedure you get done, you're going to have to keep paying co-insurance until you meet a new number called the maximum out-of-pocket. The maximum out-of-pocket is how much money you pay out of your own pocket before the insurance starts covering 100% of all the costs for the rest of the year until the deductible resets. And that number could be like $15,000. Essentially, it means if you have a high deductible and you have a co-insurance, you might have to pay up to $15,000 out of your own pocket before the insurance says, okay, I'll cover everything afterwards, but it'll still reset at the end of the year. This is why if you're shopping around for health insurance plans, it's helpful if you know you're going to need to do some procedures in the following year. And you can kind of look around to see whether or not you should invest in getting a higher premium plan that might have lower deductibles and find out whether or not it has co-insurance before you proceed and buy the plan. Okay, hope that helps.